True or false? A retiring couple can expect to spend roughly $245,000 on healthcare throughout a 25 to 30 year period. It's true. And actually, Fidelity just came out with a study that was released the other day. It's closer to 300 because medical costs are just increasing more and more at this point, right? So I would expect closer to 300. All right. Well, how much exactly, not exactly, but within a good range is this going to cost me? I don't know exactly, right? So I broke this section up into 3 phases of one's life. So if you retire prior to age 65, you have certain options. Retiring at 65, you go on Medicare. And then age 85. And I chose age 85 for a reason. Of all the clients that we have in our office upstairs, right, who own long-term care insurance, 70% of those clients are on claim, meaning that 7 out of 10 of those clients that own long-term care insurance are using that long-term care insurance to pay for long-term care expenses, which in my world, when I'm developing a plan for somebody and they're age 65 or younger, that's a damn near certainty. Okay, that's something that I need to incorporate in somebody's financial plan because it's a pretty good probability you're either going to need long-term care insurance or you're going to need to figure out how you're going to pay for it on your own. Okay? So let's start with before age 65. COBRA is one option. Okay? If you're not still working, COBRA is an option. It's just continuation of workplace benefits for the most part. Now, when you work for an employer, your healthcare insurance is typically subsidized quite a bit, right? They cover about 70 to 80% of the full premium. You cover the delta, right? When you are on COBRA, you are in charge of that full amount, plus another 2%. So they like to just kick you while you're down and tack on a service and administration fee for supplying the COBRA insurance, okay? So 102% of the entire premium is on you. These numbers up here are for a couple, and we just assume that $150 per paycheck is coming out of that individual's paycheck for healthcare insurance, all right? So these are just the numbers there. Comes out to be about $13,000, which is well within the range of what we've experienced, which would be that to $20,000, depending on what you need and the insurance that you're comfortable with. The other option that you have is I think the Access Healthcare Connecticut network, which would be privatized healthcare. Typically what we recommend for people is going forward with a high deductible, low premium plan, and then funding an HSA. Right? You can take the tax deduction on your tax return for funding the HSA and going forward with that plan. Now, age 65, Medicare. Right? Medicare is wonderful healthcare insurance, or original Medicare is wonderful healthcare insurance. Original Medicare consists of Part A, which is your hospital coverage, Part B, which is going to be your doctor's visits, checkups, and that sort of thing. Something called supplemental Medigap, which is insurance that basically catches anything that falls between the cracks of Part A and Part B, any costs that come through. And then Part D, which is your prescription drug coverage. Now, Part B, right, currently, is a standard $134 per person per month. Part A is free for anyone that is a U.S. citizen and has paid Medicare taxes out of their paycheck. Supplemental, the most robust plans are F, G, and N currently. Pricing ranges quite a bit for your supplemental insurance. I've seen it as low as like 64, something like that, all the way upwards of 400. It's expensive. It can be expensive. Part D is prescription drug coverage. The reason why I say here it must be reviewed annually, as we age, chances are that when we go to the doctor and he prescribes us new medication, if we have a certain plan that doesn't cover that medication, those costs are coming out of our pocket, right? So if you get prescribed a new drug, you're going to want to review it annually to make sure that your plan covers that drug so you're not paying for it out of pocket pull out of pocket. Now, under the Medicare umbrella, you've got Original Medicare, which is what I just talked about, and then Medicare Advantage. Medicare Advantage is also known as Part C, all right? It's privatized Medicare for the most part. It acts very similarly to an HMO, where you have in-network providers that you can go to. If you go out of network, costs are on you. I typically don't recommend the Part C because Original Medicare is such a wonderful coverage. And then in the event that you need to go see a specialist that's not within the network, that's not really something that somebody wants to deal with in retirement. They want to go see the doctor that's the best and that can help them. All right? Now, if we go to age 85, again, this is where the long-term care picture kind of steps in. So just to give you guys an idea of what an assisted living facility costs, okay, which on the spectrum of long-term care, you have home health care, which is kind of your basic. Assisted living would be like a middle-of-the-road service, and then you've got the private nursing, skilled nursing facilities, which would be the most expensive. Now, the average Connecticut assisted living facility cost for a person is about $5,000 per month, and that's currently, that's today, okay? So if we go to a couple, $10,000 a month. Like I said, 70% of the retirees that we have that own long-term care insurance are on claim. What long-term care costs does Medicare cover? The answer is very little, okay? Medicare has a stipulation in their skilled nursing facility section within Part A. They will cover days 1 through 20 in a skilled nursing facility. Days 20 through 100, it goes to like a co-insurance model where you share the costs. And then after day 100, it's on you. Just to give you a feel, the average long-term care need is about 1 to 3 years. So if you're only getting 100 days from Medicare, you better know where the money's coming from, right? If you don't own long-term care insurance, it's coming out of your savings. It's coming out of your portfolio in retirement. It's the only way it can be paid for. So that's why I say, as far as somebody's ability to sustain their lifestyle in retirement over a 30-year period, if you haven't figured out exactly what pool of money you're tapping into if you choose to self-insure, you need to do that because it's going to drain your assets. That's where it's coming from. Any questions? Bottom line is healthcare is going to be expensive, okay?